Hi, I'm Michael. I'll be your nurse today. Before we get started, I'm going to go ahead and provide some privacy and wash my hands. Make sure that's closed. All right. Go over and wash my hands. So, before we get started, can you tell me your name and date of birth?
Margaret Gallagher, 5'2", 45.
Okay, I'm just going to double check that on your wristband. All right, that looks good. I'm going to get your vitals, your blood pressure, pulse, respirations. Is that all right?
Mm-hmm.
Okay. What seems to bring you in today?
I can't seem to catch my breath and my legs are very swollen.
Okay. Yeah, so you were admitted 10 days ago for the same thing? So let's take a look at your meds. Do you have any allergies that you don't know about?
No.
No allergies, okay. So I see they got you on Vasotec, Actos, Lasix, and potassium. Does that sound about right?
I think so, yeah.
Okay. Do you know what any of those are for? What you're taking?
One of them's for my heart and one of them's for my diabetes and one's my water pill.
Okay, perfect. Yeah. The Vasotec, that's a ACE inhibitor. What that's going to do, it's going to reduce the workload on your heart and lower your blood pressure. The Actos, that's for your diabetes. The Lasix, that's your water pill. That's going to cause you to lose fluid. And being that we got you on the Lasix, we also got you on the potassium, because that's going to go ahead and maintain your electrolytes from all that fluid loss. So I'm going to have the doctor come in and see you. But before that, do you have any other questions for me?
I don't think so.
Okay. So I'm going to go grab the doctor and we'll be right back.
Okay.
The doctor have to say.
Well, he changed my medication and I don't really know why.
Okay, let me check that out. Okay, yeah, I see you changed your Actos to Glucotrol. The reason for doing that is the Actos actually is causing the edema. It's going to cause you to retain fluid and gain some weight, so that's why I ended up changing that one. He also added a beta blocker, I see. The reason for that is just it's an antihypertensive, so it's going to reduce your blood pressure and do that for you.
Well, how come my water pill's now in my IV?
The reason for that is it's just going to be a little bit faster acting, just going to start working a little bit quicker for you.
Oh, okay.
And is there any other questions you got for me?
I don't think so.
No questions? Okay. So there's your call light. If you need anything, just give me a call. But other than that, I will come check on you in a little bit.
Okay, thank you.
So hey Margaret, how are you feeling today?
I feel a little better.
A little better than yesterday?
Mm-hmm.
Good. So the only changes I see in your chart is the doctor added digoxin. Behind this, what this does, it's going to make your heart pump stronger. It's going to increase contractility. But the few things I wanted to go over with you was the toxicity. So if you got too much of it in your system, just different things you want to look for.
Okay.
So you definitely want to look out for like any visual changes. So you might, if you see any like yellow hazes or I guess halos they call them. So if you're looking at something, you'll see like a little halo around it. Those you definitely want to pay attention to. You might have some confusion or dizziness. Irregular heart rate is another big one, so you might feel like your heart fluttering or any different things like that. You definitely want to give us a call right away and let us know what you're experiencing and just kind of what's going on.
Okay.
Do you have any questions?
No.
No questions? All right. So there's your call light. Be sure and give us a call if you need anything.
Okay.
And I will be back to check on you.
Thank you.
I wanted to go over a little bit of discharge planning for you. Just a plan when you get home so you keep up with everything and we're not seeing you back here in a couple more days.
Okay.
A good acronym we like to use is MODS. It stands for Meds, Activity, Weight, Diet, and Symptoms. So we're going to go ahead and go down that. For meds, so what you want to do with your meds, you want to make sure you're taking them every day on time. If you got any problems taking your meds or you forget or anything, those weekly pill boxes, those seem to help a lot of people out. Also, if you something you do every day, like brush your teeth, if you set it by the counter somewhere you'll remember, that's also a big help. Activity, so you're going to want to limit your activity. You still want to be active, but you don't want to be overactive, and
Can I
it's just
still
a little
take
bit
my
harder
little
on your
dog Rosie for a walk?
Oh yeah, definitely. You can still go for walks. That's definitely a good way to stay active and work out. Weight's another big one. So every morning you want to get in a routine of every day go to the bathroom, maybe just hop right on the scale after that. And if you have a little chart, maybe in a pen by your scale, you can mark that down every day and notice any big weight changes. If you gain more than 2 pounds a night, that's a trigger you're gonna kind of want to look for, or 5 pounds in a week. So
What should I do if I gain some weight?
if you gain more than 2 pounds in a day or 5 pounds in a week, just call us, let us know, and we might have you come in and go over some stuff with you. Diet. So the diet you're gonna want to be on, you're not gonna want to have a lot of fluids. You're gonna want to limit your fluids and try to reduce your sodium. So low sodium diet, not a lot of pre-made stuff. So the fresher the fruits, the better probably. If you have any canned foods, maybe rinse them off, so that'll help take some of the sodium off of them. And symptoms. So you're gonna want to know your symptoms. Just different things to look for. Like I was telling you earlier, if you're having any visual changes or anything like that, you want to notice that. Any mental, so if you're confused, you're just feeling dizzy, you're just not with it, definitely want to give us a call and let us know what's going on. And do you have any questions about any of that?
Not right now, I don't think so.
Okay, perfect. Well, you still have your call out, so if you think of anything after I leave, just go ahead and give me a call and I'll come back and talk to you about it.